right, so let's just assume our hip flexor is tight. What do we do? So with hip problems, sometimes what happens is your hip gets jammed up into what's called your acetabulum. It's where the femur or the leg bone gets jammed up into the hip. Okay? So the first thing we're going to do is try and help create a little bit more space and distract that hip joint. You're going to get a band like this. It's going to be a high tension band. Wrap it around something sturdy. Put your heel in there and you're going to cross it over so that you don't slip out like that. And you're just going to back up and lay down. Now if you're having hip problems, this should feel really good. Okay? Just back up and just let it distract that hip. You're going to hold this for about 2 to 3 minutes. Okay, now that we distracted the hip, the next thing we want to do is we want to pull it out, because usually the hip gets jammed up in the middle part of the acetabulum. So we want to pull it out. So we're going to take that band, we'll put our leg in there, and you're going to bring it all the way up to your hip, as high as you can go. And you're going to walk yourself out so you feel a nice tension. And you'll be on all fours. Now you're going to try and find a place where it may feel a little stuck, either a little bit forward or a little bit back, and just hold that. Okay? Remember to use your bracing and keep your abdominals nice and tight. You're going to hold that for about 2 to 3 minutes. And again, shift your weight a little bit so that your femur moves in its new position. All right, the third and final thing we're going to do for that hip is we're going to place it up high towards the glute. You're going to take a step back. And now keep your glute contracted, keep your abdominals tight, and we're trying to pull that femur forward. So we've pulled it, distracted it, we pulled it out, and we pulled it forward. Okay, and again, abs tight. We don't want to do any of this. And hold this about seconds to about 120 seconds. Okay, and be careful when you come out of it. Okay, so one of the problems with hip issues and with sciatica is a muscle called your piriformis. Now you have 2 muscles that externally rotate the leg. One's the piriformis and one's the hip flexor. So we want to kind of see where our problem is. And the first thing we want to do is just lie flat on your back and see which leg turns out more. So when you lie flat on your back, you're going to look at your leg. And one should turn out a little bit more if you have an issue with your hip flexor or your piriformis. And that's the tight side. All right, so in our example, my right side turns out more than our left. So we're going to look at tight piriformis or a tight hip flexor. Now how do we know which is which? Okay, so let's check the hip flexor first. When we check the hip flexor, what you want to do is you want to come over to the edge of a bench like this. So your glutes are half off, half on. You're going to grab the leg that you're not testing and you're just going to lie back. And what we're looking for is where the leg that we're testing is. Now if it's parallel to the floor, then we know that our hip flexor is not that tight. If however it's up like this, then we say okay, it's possible hip flexor is tight, but it's also possible that it's the quadricep that's tight. So what you can do is straighten out your leg, and if you straighten out your leg and it comes down, then we know it's not the hip flexor, it's the quadricep that needs to be stretched. If however it's up like this, straighten it out and there's no change, then we see it's our hip flexor. All right, so let's just assume our hip flexor is tight. What do we do? So to stretch your hip flexor, what you're going to do is you're going to take a kneeling position. Okay? And again, we want to brace. So remember, our bracing is always key to all these exercises. I'm going to take a knee, and what you're going to do is you're going to lean forward, keeping your back straight. Problem that most people do is they arch their back, which we don't want to do. We want to keep our back nice and straight. And come forward. We don't want our knee to pass our toe, but come forward. It's about 15 degrees, and you're going to feel a stretch right in here. Now what you also want to do is try and pull your hips forward. So pull them forward. That's going to create a little bit more stretch here. And the next thing you want to do is take your hand and you're going to reach up this way. It's going to create a stretch along this line. Because we have something called fascia. Fascia is kind of like a covering that protects the muscle, and it also gets tight and sticky. Anybody who's cut a piece of chicken breast knows fascia. Fascia is that white piece of film that's over the chicken breast. So we want to just do something like that. Again, hold it for about 90 seconds to 120 seconds. Now, if our quadriceps were the one that was tight, we want to do a quadricep stretch. The way we want to do that is, you can lie on the ground, but I'm going to lie on my table. You're going to lie on your side. Your non-stretching leg, you're going to pull it up to protect your low back. You're going to grab your other hand, you're going to grab your foot, and you're going to bring your leg back. And you should feel a stretch in your quadricep. Now, common errors in this stretch is the leg tends to pop up like that. So make sure the knee stays down, and then bring the knee back. And again, you're going to hold this 90 seconds to a minute and a half. Okay, making sure that the knee doesn't pop up. So we gave you a stretch for the quadriceps. Now, oftentimes we need to loosen up that fascia in the quadriceps too. Now, the ball will work, but because it's such a large muscle group and a large surface area, it's probably better to use a foam roller. So we're going to take our foam roller, put it on the ground, put our leg on it. You can bend the other leg if you like, and you're just going to roll it. Again, roll the inside, shift, roll the outside. And for me, I feel a little bit more problem on the outside, so we'll spend a little extra time right there. Right? Spend about a minute and a half rolling this out. That should really help loosen that quad up. So if you found you had weak quads, a third way you can loosen them up is going back to a massage stick. And you just roll it out. Just like that. Okay, spending a little extra time any place that you feel that's a little bit extra sore. So you might have noticed that your TFL is tight. Okay, that's the muscle out here. And so what we're going to do is we're going to take our ball and we're going to work that TFL. And the way we're going to do that is we're going to come down the ground. So the TFL attaches into what's called your iliotibial band. It attaches into the lateral part of your knee. So you might notice knee problems if you have a tight TFL. So we're going to take our ball, bring it right in front of the knee, and I'm just going to roll and feel, oh, right there's a little tender. Spend a little extra time right there, rolling that out. And then go up higher, and you roll all the way up. So we just rolled out your TFL, and again, you can do that with a ball, you can do that with a stick. Now we need to stretch it. So we're going to stretch this TFL. And the way we're going to do that is by crossing this leg over. So you can keep the stretching leg in the back, and you're just going to lean over. I'm going to use something to hold me so I don't fall over, and you're going to stretch. Keep the upper body nice and tight. Make sure we keep our bracing done, and you should feel a stretch right in here. Step over and push that hip out. Okay, from the front, stepping over, pushing that hip out, and you're going to stretch right in here. So that will cover your hip flexor. Now, another thing you want to look at with your hip flexor is you might have some trigger points in there, or that fascia might be really tight. So what you want to do is you want to grab your ball again, and you can use a tennis ball if you don't have this, but other than that, you're going to put this on the ground, and it's going to be right in here. You're going to roll it in. So I'm going to show you what's going to happen. It's going to go down on the ground, and put it right in that hip, and you're just going to roll back and forth. Okay, feeling for any place that's tender. If you find a tender place, spend a little time rocking in smaller circles until that tenderness dissipates. Hip flexor also tends to be tight in people who have low back issues because that hip flexor connects to the lower 5 lumbar vertebrae as well as the discs. So when we sit all day, we're sitting in this position, that muscle's short. Now we're sitting 8 hours a day, that muscle stays short 8 hours. Now all of a sudden we get up and it stretches, and it pulls that low back and those discs forward, puts a lot of tension on them. So this is an excellent exercise to help loosen up and release that low back. So when we talk about muscles that are tight, we also have to think about maybe a muscle is weak. right? Because muscles work in tandem, right? If a muscle is tight, an opposite muscle is weak. So the way we want to check our hip flexor, if we have a weak hip flexor, okay, is you're going to bring your hip flexor up to about 90 degrees, like this, okay? Now what you want to do is, from here, just lift it up and see if you can hold it. Another way to do that is just grab your hip, hold it up here, and then let go. If your hip stays like that, then you say, okay, hip flexor is doing its job. If it tends to do that and pop out, what happens is you have a weak glute medius on the opposite side, because glute medius holds your pelvis high, and if it drops like that, your glute medius is not working, and I'll show you how to do that in a moment. If, however, it pops in, it means a TFL, which is a muscle right here, okay, it needs to be worked, okay. If it tends to just drop, it means that that muscle is weak, and we need to do exercise on that muscle. So let's show you how to exercise that hip flexor. So to exercise the hip flexor and to strengthen it, we're going to use these bands. Okay, now they come in 3 different sizes. Okay, this is the easiest one, and then the black's the hardest, and the red's the middle one. Let's start with the easy one, shall we? So what you're going to do is you're going to put it on one foot and on the other foot. So we start with our feet like that, okay? We're gonna bring our hip up and just hold it just like that, okay? And now your hip flexor is working pretty hard to hold this up. Now we're using the lightest band possible, and this is still pretty difficult, okay? And just hold that for 15 seconds and relax. And do about 10 reps of those. So if you notice during that hip flexion exercise that your hips tend to drop down, we wanna work our glute medius. And I wanna show you 2 different exercises. We're going to use our small band again. I'm going to bring it up to just above the knees and take a stance like that. So all you're going to do is bring the knee in and out, in and out. So that's going to work our glute medius and our minimus, because it's an external hip rotator. Just like that. Okay, so one other thing you can do is that glute medius is a stabilizer. So we're going to be working the left glute med on this side. Find a step. You're going to step up, and what you're going to do is just drop that hip down and lift it up. Drop the hip down and lift it up. Okay, again, make sure we keep our bracing. We're using our transverse abdominis, keep us nice and stable. And hip down, and to make this a little more challenging, you can put an ankle weight on. Okay, and that's going to also work your glute medius. It's going to stabilize that joint as well. So you want to come from the hips. So another glute medius strengthening exercise to do would be to lateral squats using a band. So we got a band above the knee. We're going to squat down, come up, take a step, and step over. So you want to control your steps on both sides. Step over, and you don't want your leg to just drop back, okay? So come over, squat down, up and back. Over, squat down, up and back. Over, squat down, up and back. And then go the other way. Squat down, up and back. Now let's move on to the major group that causes all that kind of sciatic problems. And that's our piriformis, okay? So the first thing we're going to do is we use our ball, and we're going to roll out that piriformis. Now the piriformis attaches from your sacrum, which is located right here, to the outside of your hip. So it goes basically like that. So we're going to use our ball to roll that part out. So we grab our ball, get on the floor, and you're going to put it right in here. Whoop. And you're going to roll right on top of it. And you're just going to roll. Okay, up and down, and then back and forth. Find any area that's a little tender, spend a little extra time on that, and roll it out. Little small circles, right? Not big movements. Roll that out for about 90 seconds. All the way from the hip to the sacrum. Once you get that rolled out, you want to stretch your piriformis. Now, the best way to stretch that is to find something like a box or something like that. You're going to put your leg in this position, okay, and you're going to lean forward. Okay, and that's going to stretch out that piriformis. And just hold that stretch. If you don't have something like that or you can't get in that position, another way to stretch your piriformis is to lie down on a mat, cross one leg over the other, grab your hands behind your non-stretching leg, and you're going to pull it up. And you should feel stretch right in here. And hold that for about 90 seconds. Now, remember we talked about a muscle might be tight because the opposite muscle might not be doing its job. So we want to look at strengthening our piriformis. And we're going to come back over to our bands. We're going to put them on our toes, on one side and on the other side. And all we're going to do is externally rotate. Okay, keeping a nice brace. Externally rotate about 10 times. Okay, do about 2 or 3 sets of this. And make sure we control the negative. We don't want to externally rotate and let it slap back. Always control it. One other exercise you can do for the piriformis is you're going to grab a table or a bench. You're going to lie prone. You're going to take your leg in a figure 4 position. You're going to hang it off the edge. And you're just going to lift your knee up towards the ceiling. Up, hold, and down. Lift up, hold 5 seconds, back down. Up, hold 5 seconds, and back down. And again, 2 or 3 sets of 10 repetitions. So now we've covered the major portions of the hip joint, right? So one last thing we want to do, and that's something called flossing, right? That sciatic nerve gets stuck in there. So we want to try and help mobilize it, right? We've already kind of released some of the fascia with our rolling exercises and our sticks or our rolling ball. But now what you want to do is make sure you have enough space so your leg can hang comfortably off the edge. Okay? You're going to extend your leg and extend your head at the same time. And then flex your foot. And then you're going to flex everything down. Extend everything up, flex the foot, and flex everything down. Extend, flex the foot, and come down. What that's doing is that's tugging the nerve from one end to the other, and trying to break up any adhesion in there, okay? So do 10 repetitions, right? So always extend the same time, and then flex the same time. Nice slow controlled movement, extend, and flex. So there you have it. There's our exercise for helping strengthen and mobilize the hip. Remember, we want to strengthen it, we want to stabilize the muscles, and we want flexibility. Those are the 3 keys: strength, flexibility, and stability. And we've covered all 3 of those as it regards to the hip joint. Right? Try this routine out. See how it works for you. Give it about 2 to 4 weeks, and your hip pain should go away, as well as your sciatica. Now, if you're still experiencing pain after about 4 weeks of giving this an honest effort, it's possible that you need to seek help from a professional like a chiropractor, because what happens is the sacrum or the pelvis can jar itself out of position. It's called a subluxation, and it needs to be put back in properly by somebody who knows what they're doing. All right? Please leave comments and let me know how it works out. If there's something I can do for you, if there's questions I can answer, just leave comments and I'm happy to get back to you. All right? And don't forget to like and subscribe so that we can add more content, and leave feedback if there's something that you want me to make a video on, and I'll get to it right away. Thanks. I'll see you in the next video.